Welcome to Lecto. Today we are going to discuss Hodgkin lymphoma. Before we start Hodgkin lymphoma, we should know the basic difference between the leukemia and lymphoma. Let's start. First of all, we should know that hemopoietic stem cell form two lineage. First one is the lymphoid lineage and second one is the myeloid lineage. From the lymphoid lineage, it will result in the formation of two cells, B lymphocyte and T lymphocyte. And from the myeloid lineage, it will result in the formation of the platelets, RBCs, red blood cell, and white blood cell other than B and T lymphocytes, which include neutrophil, eosinophil, basophil, and monocytes. If the mutation occur in only lymphoid lineage, which affect B and T lymphocyte, then it results in the formation of lymphoma, which is actually characteristic of lymphatic system. Its origin is lymphatic system, lymph node. And if the mutation occur both in lymphoid and myeloid lineage, then it affects all cell lines, B cell, T cell, white blood cell, red blood cell, and platelets. Then it results in the formation of leukemia, which is actually the character of bone marrow. Its origin is bone marrow. From the bone marrow, the cell will release or secrete into the blood, and on the basis of this we call it a liquefied state. This is actually a liquefied state, and lymphoma is basically a solidified state. This is actually the solid mass deposited in the lymph node. So, important point is that lymphoma can convert into the leukemia. How? Some cells which are present in the lymph node in case of lymphoma will release into the blood, and it will result in the transformation from lymphoma to leukemia. And in some situation, which is in the leukemic case, blood cell move into blood, and from the blood they will move into the lymphatic system and deposit over there. Only the white blood cell can do that. So in some situation, leukemia can convert into the lymphoma. So both of these are interconvertible. If we talk about etiology, then you should know that NF-κB, nuclear factor kappa B, this is actually a protein. That involved in the proliferation of the B cells, B lymphocytes, and its survival. When this protein activates, it will result in the proliferation of the several B sites. In Hodgkin lymphoma, NF-κB, when some somatic mutation occur, then due to this somatic mutation, NF-κB protein activate and it result in the proliferation of the B cells. Second one is the Epstein-Barr virus, EBV. In most situations, we see Epstein-Barr virus denoted in Reed-Sternberg cell, which is the basic character of the Hodgkin lymphoma. We talk later what is Reed-Sternberg cell. So basically Epstein-Barr virus has involvement somewhat. If we talk about history, then first of all Thomas Hodgkin, which identified the disease or which discovered the disease called Hodgkin lymphoma. So on the basis of its name, we called it Hodgkin lymphoma. An important character of the Hodgkin lymphoma is the Reed-Sternberg cell. Reed-Sternberg cell, RS cell. Carl von Sternberg and Dorothy Reed contribute in the RS cell, Reed-Sternberg cell, which is actually present in the Hodgkin lymphoma. If we talk about clinical features, so how patient present to the physician. First of all, lymph node will be large. Lymph node will be large, asymmetrical, and discrete. You can easily palpate the lymph node. In normal situation, you cannot easily palpate the lymph node. But if there is infection in the lymph node, then you can easily palpate lymph node, which is called lymphadenopathy. In most situations, 60 to 70% of the patient cervical lymph nodes are prominent, and in 10 to 15% patients axillary node is prominent, and in 6 to 12% inguinal node is prominent. And in some situations retroperitoneal nodes can also be affected. This is actually present in the abdomen, and which is along the capillaries and the arteries. And how will you diagnose that the retroperitoneal node is involved? So you can check it by CT scan. CT scan. Because these nodes are superficial and you can easily palpate it. But retroperitoneal node, you cannot easily palpate it. You have to do CT scan for its confirmation. Second, you can also you can see modest hepatosplenomegaly, enlargement of the spleen and the liver. This is in some patient, not all. Next is the mediastinal. Mediastinum is basically space between the lungs in the chest cavity. And you can confirm mediastinum by two ways. First one is the X-ray and second one is the CT scan. If we talk about X-ray, you can see on this screen, left lung is relatively smaller than right one, and you can see lot of white mass on the left side. And in X-ray, left hilar node will prominent. Hilar node is basically hilar node is actually present at the position where bronchi and different blood vessels enter into the lungs. And if the hilar node enlarged, then you can see on the X-ray just as shown on the screen. And second one, you will see pleural effusion, increment in the pleural fluid. You can also see that on the left side there is a large whitish area, and it shows that there is a increment in the pleural fluid. Next one, if we talk about CT scan, then axial CT scan, axial view CT scan, then you can easily show on the screen that the yellow dot you can see, this represent the enlargement in the mediastinum space enlarged in the Hodgkin lymphoma, which is shown by the yellow dot. And red dot which is shown on the screen shows the enlarged hilar lymph node, and the arrow which is shown on the axial CT scan is basically enlargement in the pleural fluid, which is called pleural effusion. So this is basically the X-ray and the CT scan. Next one is the constitutional symptoms, which is actually the general symptoms. So these includes fever, weight loss, alcohol induce pain. The pain which is induced, which is caused by the alcohol drinking, and cachexia, which is actually the weakness in the body. So next we will discuss variants of the Reed-Sternberg cell. So we will discuss 4 variants: classic Reed-Sternberg cell, mononuclear cell, lacunar cells, and lymphocyte predominant cell. Classic Reed-Sternberg cell look like there is a cell and they are multinucleate. Here there are 2 nucleus having nucleolus in it, So this is the basic classic Reed-Sternberg cell, and they look like owl in shape, owl eye. They can also be in the form that here there is a classic Reed-Sternberg cell, and there are 2 lobes of the single nucleus having nucleolus in it. They also look like owl's eye. So this is basically the classic Reed-Sternberg cell. Next is mononuclear, having 1 nucleus in it. So they actually look like, here is mononuclear cell and here is the nucleus, and at the center this is the nucleolus, and they are also called, mononuclear cell also called Hodgkin cell. And next is the lacunar cell, having is lacuna means cavity space. Here is a cell, this is a cell having cavity. Actually this is a cavity at the center. Why cavity is produced? Because the cytoplasm compressed to the periphery, and in them, here you can see, between them there is a nucleus, and inside the nucleus there is a nucleolus. So on the basis of the lacuna present in these cells, we call these cells lacunal cell. Last one is the lymphocyte predominant cell. This is very much important. Lymphocyte predominant cells look like, these are the cell having nucleus in the polylobulated form, having nucleus having many lobes, and they look like popcorn. So lymphocyte predominant cells also called popcorn cell, because the nucleus which is present in these cells look like popcorn. Next, we will talk about diagnosis. How we can diagnose the Hodgkin lymphoma. When biopsy of the lymph nodes come to the lab, we can see 2 cells in the microscope: neoplastic cell non-neoplastic cell. Neoplastic cell will be Reed-Sternberg cell and its variants, and non-neoplastic cell will include eosinophil lymphocytes, plasma cell as well. Why these cells are present along with the Reed-Sternberg cell? Basically, Reed-Sternberg cell release a cytokines which is called interleukin 5, which stimulates the proliferations of the eosinophil, and it can also release a factor which is called interleukin 13, which proliferates the Reed-Sternberg cell itself. So Reed-Sternberg cell has contribution in the proliferation of these cells. And next is the classification according to the WHO. Classical Hodgkin lymphoma and nodular lymphocytic predominant. It includes 3 types: nodular sclerosis, lymphocyte rich, mixed cellularity, and lymphocyte depleted. Nodular sclerosis, collagen fiber and cover the lymph node. Actually, you can see this is a lymph node and the collagen fibers cover this lymph node. This is in the nodular sclerosis. As name indicates, when the collagen cover the lymph node, they will become hard, sclerotic. And next is the what type of Reed-Sternberg cell are present in this cell. In this type, lacunar cells present in the nodular sclerosis, and along with eosinophil also present in them, which is non-neoplastic. Only the neoplastic cell will be the Reed-Sternberg cell and its variant. Lymphocyte rich, it's mean lymphocytes in them, lymphocytes are in abundant amount, but Reed-Sternberg cell will be scanty or low in amount. Mixed cellularity, in them Reed-Sternberg cells are numerous and lymphocytes are also approximately equal to the Reed-Sternberg cell. Lymphocyte depleting, in them there are 2 situations. First one is the we will see lymphocyte depleted case in microscope in fibrosis pattern and in reticular pattern. You will see 2 forms, reticular pattern and fibrotic pattern. In them, Reed-Sternberg cell will be high compared to the lymphocyte. So this is the basic case. It means when the lymphocytes are rich, then Reed-Sternberg cell will be low, and when the Reed-Sternberg cell are high, then lymphocytes will be low. So this is basically the 4 types of the classical Hodgkin lymphoma. Next one is the nodular lymphocyte predominant. In them there is no Reed-Sternberg cell, but its variant, which is called lymphocyte predominant cell, which is called LP cell. Important point is that Reed-Sternberg cell and its variant show a marker CD15 plus CD30. These markers are presented by the Reed-Sternberg cell. Reed-Sternberg cell show two markers, CD15 and CD30, except lymphocyte predominant cell. Lymphocyte predominant cell show B cell marker, which includes CD10 plus CD19 plus CD20, etc. These markers are only shown by the lymphocyte predominant cell, which is actually the variant of the RS cell. Again, Reed-Sternberg cell and its three variant show two markers CD15 and CD30. But lymphocyte predominant cell only show B cell marker. These markers are also shown by the B cell and lymphocyte predominant cell. Next is nodular lymphocyte predominant type. There is no neoplastic cell present in that situation, but some lymphocytes can also present in them. So this is basically the classification of the Hodgkin lymphoma. So this is all about today's. If you have any question, then you may ask in the comment section. Thank you.